I think the outbreak can still be contained, but I think it'll take really dramatic action on the part of federal authorities, helping to get vaccines and treatments out to people really quickly.
He's talking about monkeypox, and the cases continue to rise across the United States. So right here in Colorado, the new numbers say that there are 53 people in the state that are known to have tested positive for that virus. To put it in perspective, that's not close to the numbers in New York or California. Those states have about 1,200 and 800 cases respectively. Last night, the Department of Health and Human Services says they're going to be bringing in another 786,000 doses of monkeypox vaccines into the United States.
That's more than double the 300,000 doses already distributed to local health departments. So today we're bringing back 9 health expert Dr. Payal Kohli to talk about vaccines with us, the monkeypox vaccine specifically. Is it new? What are the options? What are we looking at?
There's actually 2 vaccines that have now been approved by the FDA for monkeypox, and they're a little different. So Jynneos, which is the one that's the live vaccine, is not capable of actually replicating inside of you. So that's the one we prefer for people who might be pregnant, have HIV, or have a compromised immune system. It's 2 injections given 4 weeks apart, and you're not fully immune until about 6 weeks go by. Now, because of the short supply, some states, including Colorado, are offering just the 1 shot, but really that's not how it's supposed to be used. There's a second vaccine as well, which is actually a smallpox vaccine that they've now expanded use for monkeypox, and that's a little bit different. So if you remember smallpox, they make that big hole in your arm. So that's a 1 shot, but it's not meant for people who have a compromised immune system because it could replicate inside of you.
Well, naturally, most of us are undereducated as far as finding out which of these vaccines we may want. If we want a vaccine, how do we learn more? I mean, you've given us a briefing, but is that up to our doctor, or should we be making that decision?
I think your doctor should help you make that decision. For most people that are healthy, they're sort of interchangeable, and we think the efficacy is probably comparable, although we don't yet know in this current outbreak how well they work. The Jynneos is in short supply. It's the preferred vaccine because it's actually monkeypox, not smallpox, but that's a little harder to come by, and it may not be something we can get. But your doctor would be the right person.
What about the decision to get vaccinated? How do you go through that?
So that one we have to make ourselves because we have to self-identify if we're in a high-risk group, such as men who have sex with men, are certain behaviors that could put us at high risk, like our sexual partners, our work, if we work in a lab or a healthcare facility, that could put us at high risk, or if we're adjacent to somebody who's high risk. And even if we've been exposed to somebody who's infected, you can actually get the vaccine even after the exposure, up to 2 weeks after the exposure. So it's a good idea to do it after as well as before.
Oh, that's different.
So it can work as a treatment.
Yeah,
that's exactly
as well as a preventative.
Yes, so there's a pre-exposure prophylaxis or prevention, and then there's a post-exposure. But for the post-exposure, you really want to try to get it in those first 4 days.
So you have to know.
You have to know that you were exposed to someone. Now you can get it from day 4 to day 14 according to the CDC, but it may not prevent infection. It may just give you a milder infection. But if you think you've been exposed to someone, it's time to pick up the phone, call your doctor, and try to find a vaccination center.
And if you had the smallpox vaccine, any benefit to that?
Yeah, so, for people that are older than 45 or 50, they may have had the smallpox vaccine. We think, yes, there should be benefit because it's the same family of viruses, the orthopox viruses. About an 85% protection is what we've seen in Africa. But the smallpox protection does go down over time. So if it's been a long time since you've had it, in fact, if they say more than 3 years and you get exposed to somebody with monkeypox, you should still then follow up with a repeat vaccination.
The name really does add to the fear factor. And it's not really a part of the puzzle, but it's there. So it's got that name. But as we stand still in the battle with COVID, I think people are more tuned into how things can spread quickly. How concerned are you about monkeypox and those numbers? We have 53 cases we know of in Colorado. You think that number's higher?
Much higher. Because we're not using testing as much as we should. We should be vaccinating more widely than we are. And I'm concerned as our adolescents, teenagers, kids go back to colleges, as schools open up, we travel more and we can be exposed through bedding and such. Those cases are expected to increase, and the director of the CDC has said that. So we all need to educate ourselves, and we need to start working on prevention, treatment, testing, all the same T's that we talked about with the COVID-19.
Pay attention.
And now here we are in a place where we can just test at home for COVID, and we're not in that spot with something else. But
not at all. In fact, the testing requires you to scrape the pimples, collect the sample from the pimples, and it's only done in specialized labs. So that's something we need to work on as the fall comes.
Wow. Well, Dr. Payal Kohli, we've learned a little bit more today. We will continue to turn to you for more information. Thank you very much.
Thank you.